I am Dr. Vijay Vishwanathan, the Chairman and Managing Director of MV Diabetes, Chennai and Bengaluru, and I would like to talk for 30 seconds on what is special in MV Diabetes. The first is we have trained doctors who can provide customized care for each of you who come to MV Diabetes. Secondly, we have a sophisticated state-of-the-art laboratory which caters to all the tests in diabetology like C-peptide and GAD antibody and so on. The third factor is, which makes us special is that we give a 360-degree comprehensive care for people with diabetes and its complications. And fourthly, we have a multidisciplinary team consisting of a plastic surgeon, a vascular surgeon, orthopedic surgeon, and a podiatrist and footwear technicians who can provide good care for your feet when you have a problem and to prevent a problem in the feet. Thank you very much. Full screen.
So we start. I'm audible, doctor?
Yeah, you are audible.
Okay. So good evening. And in this run-up to the World Diabetes Day, which falls on November 14, The Hindu brings you the webinar on well-being among people living with diabetes, presented by the MV Hospital for Diabetes, which has branches in Chennai and Bengaluru. I'm your host, Shoma Basu, Senior Deputy Editor with The Hindu, and it is my privilege to introduce Dr. Vijay Vishwanathan, Chairman and Chief Diabetologist at MV Diabetes, who will talk on the important topic. And today's topic, it aligns with this year's World Diabetes Day theme, that is physical and mental well-being and its connection to diabetes. Dr. Vishwanathan has been elected the national president for the year 2025 of the Research Society for the Study of Diabetes in India. He's also been the immediate past president and the first non-European president, and is currently the honorary president of DFoot International Belgium, an organization consisting of diabetes experts from 193 countries. A practicing diabetologist for about more than 33 years, Dr. Vishwanathan did his PhD in diabetes and kidney from Dr. MGR Medical University in Tamil Nadu. As the president of Professor M. Vishwanathan Diabetes Research Center, Chennai, he has published over 200 original papers in diabetic foot, diabetic nephropathy, diabetes and TB, and socioeconomics in diabetes. Recipient of the first Vivian Fonseca Award from the American Diabetes Association for his research paper on diabetes and TB in 2013, Dr. Vishwanathan was also awarded the honorary fellowship from the Faculty of Pediatric Medicine, Royal College of Physicians and Surgeons, Glasgow in 2021. Welcome, Doctor. Nice having you here.
Yeah, thank you, Ms. Somabasu.
Yeah, so I was just recalling, like it is important that every individual focuses on his or her physical and mental well-being. And when you have an ailment chasing you, it becomes all the more important to be careful and be alert about your health. And in this backroom discussion, you were also mentioning a very interesting point that people living with diabetes can actually and perhaps are able to maintain a healthier lifestyle than others, given their regular checkups and treatment, their diet restrictions, their exercise regime, and mindful living. And you also briefly said that cheat days are allowed once in a while if you are a disciplinarian. So I think it would be fun listening to you on today's topic first. So let us have your presentation. Over to you.
Yeah, I have about 8 minutes presentation.
Sure.
Following which we can take questions. from the audience? Can I show the slide? I don't know whether you're able to see.
Not yet.
I'm not seeing the share button. Share button, yeah, share. Go on with your questions.
Or if you could just speak extempore, just to introduce the subject for 2-3 minutes, and then maybe, because we have not yet started receiving questions also from the participants. If you wish to speak on the subject.
Just give me 1 minute.
Yeah.
1 second, rather. Can you see it
Yes,
now?
sir. Yeah, it's visible.
Let me go to the full screen now. So the theme of this year and the next year and the year after next by the International Diabetes Federation is well-being among people living with diabetes. So you see that the terminology diabetics has been avoided by the International Diabetes Federation, and they are using the term people living with diabetes. So they are also people. They are also human beings. So why should you call them a diabetic? So the word diabetic is gone from the dictionary. It will soon disappear from the lexicon. And well-being among people living with diabetes is the term which is going to be used today. As you rightly said, this is a preparation for the World Diabetes Day, which is on November 14th. And November 14th happens to be the birthday of an orthopedic surgeon, Sir Frederick Banting, who was the discoverer of insulin in 1923. The insulin was the breakthrough of the century, and the International Diabetes Federation, the World Health Organization, decided to celebrate his birthday, Sir Frederick Banting's birthday, as the World Diabetes Day on November 14th. This year, the theme is well-being, both physical and mental. And we are happy that we have inaugurated, just before we knew about this, the mental, the mind wellness clinic in our hospital in Roypuram 2 years ago. Physical well-being is also important. So both the people with diabetes should have a physical well-being and a mental well-being. And it's very important that it's to know the definition of diabetes. It is either insulin which is not produced, as in type 1 diabetes, or insulin is not working, which is called insulin insensitivity, insulin resistance. So there are two things happening to insulin. Either the insulin is not produced from the beta cells, or there is a secretory defect, as we call it, or there is insulin resistance. Now, the mental wellness is very important. You should eat well, you should manage stress, you should rest, sleep enough, you should exercise enough. If you sleep at 2 o'clock and get up at 5 o'clock, you're not going to have the mindset to do exercise. So you can do any physical activity, aerobic exercise, you can do anaerobic exercise, isometric that is, and you should do yoga, which is stretching. So we have different types of mental or mind wellness, which is also very important for a person with diabetes. Now, today is the era of AI and latest technologies. So do we have the latest technologies at MV Diabetes in Royapuram? Yes, we have. That's what I'm going to show you. So AI has played a very important role in diabetes care, and this is what I'm going to show. The first is the footwear about which you saw in the slide. We make footwear for people with diabetes who have loss of sensation, who have deformities in the feet, which is called offloading. And we make footwear for people who do not have any loss of sensation too. So this are comfortable footwear, which is designed with the help of CLRI and CFTI. CFTI students played a major role in it. And we have shoes, we have sandals for men and women being produced in our hospital. We have worship socks, which is used by people when they go to when they go to a temple or a mosque. You cannot walk barefoot, so you should wear a worship socks, which looks like that. It's got a protective covering inside, and it can be used for people when they go to pray. We have tests which are AI related, now coming directly to AI and deep learning. We have apparatus which are linked to the ultrasound, which can pick up the prevalence of future occurrence of cerebrovascular accidents, strokes, brain attacks, or heart attacks. So you can detect changes in the blood vessels much before you get a heart attack or a brain attack. So this is called Auropoint. There are point of care instruments now, which is available for HbA1c, albumin in the urine. So it cuts down your time by to see the doctor. It's the doctor's time which is important, not the laboratory time. So the laboratory time is cut down by these point of care equipments which are now available. And it is available for HbA1c, which, as you know, is a very important test which we do for people with diabetes, and albumin in the urine, and so on. We also have for cholesterol. We have for many other parameters the point of care instruments. The tuning fork, by using the tuning fork, we can detect loss of sensation in the feet, and which people require special footwear and which people can develop foot ulcers. Now, if you have loss of sensation, we have been collaborating with Stanford University in the United States, trying to find out which patient will develop a foot ulcer. So if you have thermal imaging, this is called thermal imaging, and it is a method to find out which patient will ulcerate or not. So you can predict brain attacks, you can predict heart attacks, you can predict the foot ulceration part. So these are the things which I wanted to say this evening before taking up the questions. So thank you, Mrs. Soma Basu, and we can take questions now.
Right. So I would like our audience to start sending in the questions to Dr. Vishwanathan. So meanwhile, I think we'll take the discussion forward. I just wanted Dr. V to reiterate the point that it is possible for people living with diabetes to lead a normal life. I mean, that fear has to be, kind of pushed out. So could you just a little bit kind of
Yeah, it is
reiterate on that? Yeah.
possible, Soma, for any person living with diabetes to live up to 100 years if he's careful. You have to be careful. You're sitting on a hot surface, you can say. You are prone for vascular disease, you're prone for infections, you're prone for uh, in- uh, you're prone for many other problems involving the blood vessels. So if you're careful enough, if you take proper care of your diet, if you exercise regularly, you can live up to 100 years. There's no problem at all. So well-being has to be ensured by the doctor, the paramedical staff who are along with the doctors, and by the person living with diabetes himself or herself. Thank you very much.
Yeah, it's a teamwork.
Yep.
Right. So, how often do you recommend a person living with diabetes? How often should they go for a checkup of the entire body or whichever tests
As
you would
having
recommend?
Yeah, having said that, that point is very important that you keep your cholesterol under control, your blood pressure under control. Today, it might be normal. Next week, it may not be normal. Your blood pressure, your cholesterol, your blood sugar, it's very dynamic. So the uh, point is you should try to have at least once a year annual checkup of your blood pressure, cholesterol, and it has now become very easy with the advent of modern technology to have everything at home. You have home blood glucose monitoring, home blood pressure monitoring, and so on, which I'll be showing you in the next 5-10 minutes. So it's all possible at home. You don't have to go to a hospital and wait for hours together. You can do it at home. Blood pressure, cholesterol. And if the point of care comes home, like in the United States, it is you can do it at home, your HbA1c every 3 months, and inform the doctor through WhatsApp or email about the values.
Yeah, I was about to come to that because I think people they have to understand that diabetes should not be and cannot be taken lightly. And you did mention that we can do these blood sugar tests at home, and you were initially you said once a year annual checkup is the right recommended period. So, would you
At
be
least,
telling us about this continuous glucose monitoring system now? Like you said, you have a slide, or should we bring it back later?
no, I can tell straight away.
Yeah.
You
Okay.
have an apparatus where you don't have to poke the finger anymore. You have 15 days monitoring, and the readings can be read by the person living with diabetes in his or her phone. You can view it in the phone. And if you load it onto a website, the doctor can see it also. The doctor can be contacted through a website, and an app is there. You download the app in the phone, and it's easy. You need not visit the doctor to, you can ask the doctor the opinion over telephone or WhatsApp or email. And it is not necessary to sit for hours together in the hospital. So the things have changed a lot. Blood pressure, the home blood pressure monitoring is now available where you can monitor your blood pressure. You can take it yourself. You don't need a second person to help you. You don't need your spouse or children to help you. You can do it on your own. You just tie the cuff and press a button, and you get the heart rate and the blood pressure. So, blood pressure and blood sugar can be tested at home. Once a point of care equipments are available, you can do that also at home. HbA1c, cholesterol, also in the home. Now, before I hand over the mic to you again, there is something called ambulatory blood pressure, which is done in the hospital. So, if the doctor feels that you have an office hypertension or white coat hypertension, he will put you on to a ambulatory blood pressure. Or if you have mild kidney problem, if you have a creatinine of 2.2 or whatever, you can actually measure the ambulatory blood pressure. And early morning, during the night rather, not early morning. In the night, usually the blood pressure falls 10%. Systolic and diastolic blood pressures fall 10% below the normal, below the daytime diurnal variation is there. So the nocturnally at night, there's a 10% drop in the blood pressure, which is normal for everybody. And it is called a dipper. You are called a dipper if there is a dip. You are called a non-dipper if you do not dip 10% in the night. That can be measured only by the ambulatory blood pressure apparatus, which is a simple apparatus which is attached to the arm in the hospital. And it can be done at home also, ambulatory blood pressure. Thank you very much.
Right. A lot of questions have started coming in, and I'll immediately take them up. Moganapriya Nedumaram is asking you to provide guidance to maintain well-being for newly diagnosed type 1 children.
See, type 1 children, you must understand, they so far are treated with insulin only. It's insulin. Somebody says they have alternative systems of medicine, they are not speaking the truth. So you have to be on insulin. Now, you should, whatever the age of the child may be, initially 6 months, the parental support is very important. Now, even if it is an adolescent who is 14 or 15, you should make sure that the parent looks after the child. You should not leave the child as it is because the child doesn't understand. The adolescent doesn't understand. Now, if it's a child who's aged 5 and 6, again, you need parental support. The child is lesser than 6 years, definitely you need support. So, newly diagnosed, first the parental support is very necessary. And the first 6 months, the insulin has to be given to control the diabetes. If you control the diabetes, the beta cell will work better and the beta cell will start producing little more insulin than what it used to. So don't give up insulin. Don't follow wrong advice. Now, in India, very soon we're going to have this is a prototype of the nasal insulin which doesn't require a needle, which can be sprayed into the nose. So this is not yet released. The studies are over in type 2 diabetes. And a company which is well versed with asthma products are manufacturing this prototype. And it is now possible to take insulin without injections. But taking insulin injection is become very simple with these pen devices which are there, and it's easy. Now, if you take the prototypes which I showed you, you can actually take insulin without injections. So the type 1 diabetics, type people living, children living with type 1 diabetes should be helped by the parent in the beginning years. And later on, you can leave the child to decide himself or herself the dose of insulin. Thank you very much.
So you focus a lot on the feet of people living with diabetes at the beginning of your presentation. Somebody wants to know that when do people and how often do people with diabetes need to check their feet?
As I said before, once a year is enough if you do not have a condition called neuropathy. Neuropathy stands for nerve damage in the feet. If you have neuropathy, a lot of things go wrong. So you should check up at least once in 3 months, once in 6 months. But as I told you before, very soon in India, we are going to have, this is a mobile phone and this is a camera attached to the mobile phone. We are collaborating with Stanford University and we can judge which patient is going to develop a foot ulcer or not by taking an image, thermal imaging it's called. So thermal imaging is going to be introduced by us very soon, where a person once a year comes in, checks for neuropathy, by a very test which I showed you, the Rydell for tuning fork and so on in the presentation. You measure the vibration in the feet, you do this camera thermal imaging, and you try to find out which patient can ulcerate or not. Thank you.
TV Manikantan is asking, what is the relationship between diabetes and frequent urination in the night?
So frequent urination can happen in uncontrolled diabetes, as you know, polyuria, polydipsia, polyphagia is all the polys are known to occur in people with diabetes. But apart from that, if you're an elderly person, if you're above 60, 70, and so on, you could have prostate enlargement also. So if you have this symptom, if you are an aged person, elderly person, you should go for an ultrasound and measure the post-residual volume, the volume of urine in the bladder before and after the urination, and see if it is more than 60 ml. If it's more than 60 ml, and if there's a prostate enlargement, you are not able to pass urine fully. You should consult a urologist and do a prostate surgery. So, prostate enlargement, uncontrolled diabetes, the polys are responsible for frequent urination at night. Thank you very much.
MC Shekhar is asking, is heart attack linked with uncontrolled sugar? And there's a add-on question to that. Mr. Pradeep Kumar says, is there any special test at MVH to estimate and predict heart attack risk and stroke risk in the next 5 years if somebody is diabetic?
Yeah,
Somebody is having diabetes. Yeah.
as I told you, uh, diabetes is a condition which is a cardiovascular equivalent. The moment you are diagnosed with diabetes, you should control your cholesterol, blood pressure, diabetes, and so on. You should exercise. You should try to reduce the visceral fat, the fat inside your abdomen by regular exercise. Otherwise, you're going to be in trouble. Now, in our hospital, as I told you in one of the slides, we have an apparatus called Auropoint, which is a software artificial intelligence attached to the ultrasound machine, where we can predict heart attacks, brain strokes by looking at the blood vessel by the intimal medial thickness. We measure it, and the pictures are sent to United States. Next morning, we get the report. So it is possible by Auropoint to predict heart attacks at least 5 to 10 years before they get heart attacks or brain attacks. Thank you very much.
Rita Julius has a very pertinent question that diabetes in the gestational period, and is it reversible?
See, gestational diabetes, if you get, they have lowered the criteria now. They're giving more importance to gestational diabetes. So every pregnant woman should undergo a screening for blood sugar at the time of pregnancy starting, not at the 24th, 28th week, as we used to do in the past. That we should try to screen people with the ladies who are pregnant. As soon as they become pregnant, we screen. And the gestational diabetes is, it's possible to treat them with lower dose of insulin with diet and exercise alone. But if you're a pre-gestational diabetes, that is, if you have diabetes before you became pregnant, if you had diabetes before you became pregnant, it's called pre-gestational diabetes. It could be type 1, type 2. You should stop and switch over to insulin. And if you're a type 1, you should take 4 times. You should use insulin pump or whatever and control the diabetes. The fasting blood sugar should be 90 to 92. The postprandial should be 130. It's a very strict criterion which we use in pregnant women. If you do all that, you can have a normal baby. Thank you very much.
I think we'll take a couple of food-related questions, because there are quite a few about the diet. Bikash Jha in particular is asking about the food habits you would recommend for a person with diabetes, what they should eat and what they should avoid.
See, the point is, people with diabetes are told not to eat this, not to eat that. I think it's wrong. They should eat like a normal person. Only then they'll feel that they're a normal person. So that's the main feature of the next year, this year, next year, and year after, the well-being. So well-being is something which is taught to people, and the whole family should sit down and eat the same food. You cannot cook separately for a person with diabetes. A person living with diabetes should eat the same food as the others in the house. So you can eat rice, eat healthy, but eat rice in a smaller quantity. And you can eat vegetables. You include more of vegetables. You include more of proteins, less of carbohydrates. So the whole family enjoys it, and the person living with diabetes is not left out. He or she should eat the same food which other people eat. But there are some important things to be followed: less of carbohydrate, more of protein, less of fat is the dictum which has been practiced for the last 40 years in India. If you have these fat diets coming in, the keto diet and intermittent fasting, so they are not approved for people with diabetes, because we give medicines for people with diabetes, people living with diabetes. We give medicines. So keto diet and intermittent fasting are not for people with diabetes. Thank you very much.
So there's a related question to this that, somebody's writing that people in the West have shown results and lost kilos of weight after eating only meat, fat, salt, water, and also the autoimmune disorder seems to have gone away. So what is your view on this?
See, it's true in one way, but uh, nobody in India can live on meat and water and so on. We need carbs. So if we are used to carbs right from childhood, so don't deny them the carbs. Reduce the carbs, but give them the carbs. Every Indian likes either rotis or rice. If you're a North Indian, you like rotis. If you're a South Indian, you like rice. So you can't deny carbohydrates to a person with diabetes just because he's living with diabetes. You can't deny him carbohydrates. Protein is something which is universally acceptable, and we in India are fortunate enough that we have proteins in our naturally occurring diet. Unlike the Western diet, we don't have to use artificial protein like pectin and guar gum and so on. We have in Tamil Nadu, we have sundal. We have in North India the channa. We have the cottage cheese. So we have North India, South India not varying in protein intake. Fat intake, we don't take. We have done a study and we have shown that the people who take non-veg take only 40 grams of protein every day. So the fat content is very poor in Indians. So you can't force them to eat more fat, more protein. There is a limit to which you can allow proteins to be elevated or fat to be elevated. But carbs, don't deny them. Thank you very much.
Palaniappan is asking, can we take herbal powders along with diabetic medicines?
We don't stop herbal medicines provided they help, they're not harmful. We do not stop herbal medicines. But don't take the herbal medicine and stop the allopathic medicine, because I am the allopathic doctor. So I'm not supposed to use the herbal medicine. So there might be herbal medicines which are good, use them, but don't stop insulin or tablets which we have given. In allopathy, we have a lot of new drugs which have come, the GLP-1 receptor agonists and the SGLT2 inhibitors, which protect not only the blood sugar component, which reduce the blood sugar component, they also protect the heart, the liver, the kidney, and the blood vessels, and so on. They reduce weight. So GLP-1 receptor agonists and the SGLT2 inhibitors have come to stay in India. They're available freely in India, in any pharmacy, in any medical shop. Thank you very much.
How much liberty would you allow allow people living with diabetes to indulge in sweets or desserts, ice creams? Can you get diabetes even if you don't consume sugar at all? These are just doubts expressed. Yeah.
The first part of the question,
How
can,
much liberty is allowed?
yeah, I think on a Diwali day or either Puja day, just, I'm saying that because it's just over. We can allow the family to consume that on that day. We're not going to take it like for 1 week. If you take sweets for 1 week, there's something wrong with you. You're going to take sweets or you're going to take a sweet dish only on that particular day. Allow them. Allow them to taste it. If you deprive somebody with diabetes, they're going to take it anyway. So they'll cheat on that day, and next day they will be very careful. So liberty should be allowed. The people with diabetes should be allowed to take sweets on festival days. What is your second part of the question? Sorry.
Mm, Second part of the question, whether people who don't consume sugar at all, do they also get diabetes?
See, the problem is the visceral fat. If you're taking anything, if you don't do exercise, if you're sedentary, you're building up visceral fat. Visceral fat doesn't come from sugar directly. It can come from a whole lot of things. You don't do exercise, you can build up visceral fat. You get fatty liver. I've seen people who are very thin who have fatty liver. So it goes to show that you don't have to consume sugar to get diabetes. If you have more of visceral fat, and we Indians have a lot of visceral fat, and we are prone for diabetes. We are one of the highest highest prevalence rate in the world, because genetically we are prone to get diabetes and because of the visceral fat. So it's not sugar alone. The family history counts. If your father or mother are diabetics or both are diabetic, people living with diabetes, you can get it because you have more of visceral fat. You don't have to take sugar.
To get that, yeah. What about the artificial sweeteners which people seem to be taking increasingly, like they're
Yesterday I
replacing the
was,
normal sugar?
yesterday I was listening to a talk by the president of the International Diabetes Federation. Yeah, just yesterday, last evening, and he was saying that the prevalence of diabetes is very high among the sweetened beverages, artificial sweeteners. So they're not harmless. They are harmful. So don't take that too much uh, in excess amount. So you take it just because it's a diet uh, product. Don't take it in abundance. It's not uh, proper to take artificially sweetened beverages. Thank you very much.
Pritika M wants to know that why do diabetes patients or people living with diabetes, and it's getting repeated, diabetes patients, sorry, why do they frequently experience recurring cyst and pain in the buttocks, and it kind of resolves on its own? So what causes this, and what are the best ways to prevent it?
So you first of all check your blood sugars. many people assume that their diabetes is under control. It may not be. So if you're getting cysts, it could either be there already in the region which you said, or it could become infected when you have uncontrolled diabetes. So check your blood sugar, treat the cyst, remove the cyst before it becomes infected, and so on. So consult a surgeon if you have a cyst. Thank you very much.
Yeah, there are a few more questions on food, but I think we'll for some time shift to exercise and lifestyle habits and also the sleep patterns, doctor.
Yeah. So sleep patterns, you want me to talk? Okay.
Yes.
Yeah, okay. So sleep, you should sleep well. There have been any number of studies which have shown a correlation between lack of sleep and diabetes. So you should sleep well, only then you are prepared for the next day. So if you have a condition called obstructive sleep apnea, OSA, you have snoring and you will feel sleepy the next day, next morning. There have been instances of people crashing their car against a tree and so on, sleep off, and so on. So you should examine yourself. OSA, obstructive sleep apnea, is a condition which is associated with diabetes. And even if you don't have OSA, if you don't sleep properly, 6 to 8 hours of uninterrupted sleep, the REM sleep or non-REM sleep should be properly there. And if you don't have that, if you don't sleep well, you can get diabetes. What is the other question other than sleep?
Like what would be, there's a lot of questions relating to exercise. So would say what would be a minimum set of exercise which you would recommend for people who are otherwise sedentary and per not yet maybe borderline or pre-diabetes. So what should they be doing?
So the problem is laziness. And yesterday talked by the president of the International Diabetes Federation from Germany. He was talking about laziness. So we should get out of bed and start walking in the evening or morning. People assume that they are doing physical activity, not a physical activity, which they are not. Homemakers say that they're doing all the work in the home. That's enough. But they're obese. They have a lot of visceral fat. So you should walk at least 30 minutes. And you should, the 100, the height in centimeters minus 100 gives you the approximate kgs. Height in centimeters, 172. If you have 172 centimeters, you should be 72 kgs. Now, if you're more than that, at least aim for, if you are above the target, you should aim for 10 to 15% or at least 10% weight loss. Now, if you ask a person who is 102 kgs to come to 72 kgs, if his height is 172, he's not going to do it. So give him a realistic target of reducing 10% from 102 or 122. Reduce it 10%, not an unrealistic goal of coming down to 72 from 122. So give him a realistic target and make the person work on it. Now, how much you walk depends on, we have pedometers today, we have phones today, which can tell you the number of steps which you take. It is estimated that if you walk 10,000 steps every day, you can lead a life which is free of diabetes or heart disease. But we don't walk that much. So at least 5,000 to 10,000 steps is what should be the target of a common man every day. Now that 5,000, 10,000 can be achieved in any way you want. You can walk as part of your work. You can walk, exercise after food. You can walk 15 minutes after each food, after dinner, after lunch, after breakfast. Do whatever you want. But you should walk 5,000, 10,000 steps every day. Thank you very much.
Yeah. So there are two very specific prescription-based questions, doctor. I'll just read them out quickly. Raja Care has been taking Gymistar MG3 since 2017. So he wants to know, is there a problem taking the same tablet for such a long time?
I do not want to go into treatment aspects in this particular well-being seminar, webinar. But having said that, he is taking a drug which improves the beta cell function, glimepiride, and metformin is SGLT2 inhibitors. Don't forget that there is uh, drugs which can act on the alpha cells. So there is a combinations available. The International Diabetes Federation today advocates a combination of drugs, SGLT2, GLP-1 receptor agonists, metformin, and sulfonylureas like glimepiride, what you mentioned just now. So there's no harm, but no benefit either. If he's taking glimepiride with metformin, there's no benefit either. So take a drug which is useful for the heart, liver, kidney, and your diabetes. Today there are drugs available. Over.
So, yeah. So Santosh Nair finds his fasting sugar consistently at 130, 140, despite, he says, avoiding sugar and carbs completely after 5 p.m. He says, my post food goes up maximum 150 to 160 a week, and I'm 70 years old and exercise 5 days a week. So why is it still on the?
It is not age dependent. You
Okay.
remember that the liver is producing a lot of glucose at night. It's called dawn phenomenon, and your fasting is going up. So you should walk for about 15 minutes, 20 minutes after dinner. And if you don't take any food, the liver will produce glucose because all your organs are working. Your heart is working, brain is working, your liver is working, kidney is working. So all the organs need energy. If you're going to stop eating at 5 o'clock, you're doing disservice to the kidney, liver, heart, and so on, which is working 24 into 7. So don't do that and don't pressurize the liver to produce glucose. So don't produce dawn phenomenon. Eat well at 8 o'clock. We all ate dinner at 8 o'clock, 7 o'clock. Take a glass of milk and going to bed. So take a healthy diet. See a dietitian. Thank you very much.
There are again a couple of questions related to insulin. Like, is taking insulin the last stage in diabetes treatment, and is insulin like a permanent feature in like one's lifetime?
It is not, as I said, insulin was we have the person who discovered insulin. The World Diabetes Day is named after him, November 14th. So if it's bad for health, he would not have found out the insulin. He would not have got a Nobel Prize for that. He would not have a World Diabetes Day in his name, Sir Frederick Banting. So it is not harmful. That's the first line. Second line is it's not always permanent. It's temporary to some extent. Now, each case depends uh, on the insulin which is given to cases. In some cases, we have to give insulin because the beta cells are worn out, are gone, are become dry, do not produce insulin. So you have to give insulin. Unless this device comes in the prototype I showed you before, you can't have inhaled insulin. You have to inject insulin. Injection is a problem. People, when they inject something, they take it like drugs. They consider it as drugs, habit forming. So insulin is not a habit forming. Insulin is necessary. And if the beta cell works on its own, after some time, you can stop it. And insulin is not bad because these devices have come where instead of vials or bottles, you can take pens. And even while traveling, you can take it. Just lift up your sari and take it. Whether you're on a flight, whether in a train, you can take it. Thank you very much.
So, what is remission in diabetes? Like people going off medicine or tablets or treatment for how many months? And then, like, does it again come back? Is there a reversal after a gap in time?
So remission is possible in the early stages. If your beta cell is dry, no insulin at all, you are not going to have remission or reversal. Now, if the beta cell is functioning well, if the pancreas is functioning well, you can go off medicines, provided you are strict with your diet and exercise. For 6 months, if you don't take any medicine, it is by definition called remission. For 6 months, you should be off any medicine. It's called remission. But there's nothing called reversal, not heard of in our common parlance. So remission is possible, but for that you should have diet control and exercise. You can't eat tons of sugar or sweets and have remission. Thank you very much.
So since this year's theme is focusing equally on the physical and the mental well-being. So Arut Selvi Devarajan is saying that when people are affected with diabetes, they also can go into depression. So is there any simple tool that could be used at the primary care level to assess the person's mental health status and maybe go in for some preventive
You
steps?
can talk to a trained psychologist, and depression can be easily found out. Every one of us have some sort of depression. So, but if the depression interferes with daily life, with diabetes control, it is abnormal depression. Dementia, for instance, we forget where we kept our keys. It's not simple dementia. But if you forget everything, then there is a test called mini-cog, which can be done in a question of 3 minutes, and you can answer some 4, 5 questions, and dementia, forgetfulness, can be diagnosed. So depression, anxiety, there are scores. If you're doing a research project, there are this. If you're presenting a research paper, you have scores. You have we have hospital anxiety scorecard. For sleep, we have scorecard. So we have scores. If you're doing a research project, you need to do all that. But otherwise, a trained psychologist will be able to easily differentiate depression from no depression, anxiety from no anxiety, and dementia from no dementia. But if you're forgetful, if you forget your own wife's name or you forget where the toilet is, you are in trouble. And if you're elderly, if you're above 70, then you're in trouble. You have probably a condition called Alzheimer's disease. You should consult a neurologist. You should try to find out whether you have Alzheimer's disease and so on.
So what preventive measures, I mean, like if you could throw a little light on the pre-diabetes condition, what preventive measures can be taken to avoid progression to diabetes?
So pre-diabetes is not recognized anymore. It's a glycemic continuum. What all can happen for people with diabetes can happen for people with pre-diabetes also. In India, there are more pre-diabetics than people with pre-diabetes than with diabetes. in India. You have more people with prediabetes than with diabetes. So there is no hard and fast rule. So prediabetes occurs about 5 years before diabetes sets in, diabetes is detected, and you should take care. You should do the same. Maybe tablets you can avoid. The government of India has permitted tablets also, but you can avoid tablets and you can do lifestyle modification LSM in prediabetes, prevent it from progressing to diabetes. But you should do LSM, lifestyle modification. You should change your diet pattern, you should do exercising, and so on, and try to bring down your weight.
So, has COVID changed diabetes management in any ways?
Sorry, COVID.
COVID has, yeah. Has the pandemic changed diabetes management in any way?
It has changed a lot because people do not want to come to a doctor's chamber. They want everything at home, number one. Number two, during COVID, the most affected were people with hypertension and diabetes. You must have heard about it. So the statistics show that people, if you have hypertension uncontrolled, hypertension and diabetes, mortality, death rates were higher in COVID. Number three, the vaccines have come to be taken seriously. Today, you have vaccines against herpes, you have vaccines against pneumonia, you have vaccines against flu, herpes zoster, that is the uh, chickenpox like condition which occurs in the adults. So you can have a whole lot of vaccines taken, and that has changed. People earlier, they were not very eager to take vaccinations. They thought vaccinations for children. But today, the adults walk into my clinic and ask for vaccination. They want to be vaccinated against herpes zoster, against flu, pneumonia, and so on. Thank you.
This Auropoint AI testing facility, where all is this available?
Uh, I won't be able to answer that question directly because we are collaborating with a person in the United States. The pictures are taken here in Roypuram in our center and sent to United States for interpretation. The ultrasound doctor takes it in the carotid arteries and he sends the pictures to images to by computer to the United States person, and he reports the very next day. So within 24 hours, the report is ready. It's not ready, we post it. If it's the person gets discharged before 12 o'clock, then the result may not be ready. So we post it. So it's available in New Delhi, if I remember right. It's available in New Delhi and a few centers which I cannot say now.
No, in your centers in Chennai and Bengaluru?
Yeah, we have it in Chennai. In Roypuram, we are we have facilities to do it in South Chennai, but not in Bengaluru. In Chennai, we have facilities.
Okay, I'll just wind up with one last question since we have come to the end of our time. How long does a person living with diabetes, how long does it take to damage the sensory and motor nerve? Some people have written that we haven't spoken much on diabetes neuropathy. So, if you could
Uh,
just take that briefly.
Even before diabetes sets in, pre-diabetes, the stage of pre-diabetes, your nerves can be affected. So diabetic neuropathy can set in very, very early. It doesn't need very high blood sugar levels. It needs only 180 blood sugar, 190 to get neuropathy. It doesn't need very high blood sugar levels to get kidney problem. It doesn't need very high blood sugars to get retinopathy or heart problem. So you don't need a very high blood sugar to get any of these complications. So you must remember that earlier the better. Every Indian should be well-being, not only people with diabetes. Every Indian should exercise. Every Indian should have control over his diet. Every Indian should be physically active and not inactive.
Thank you for that message, wind up message. Nice one for the World Diabetes Day. Doctor, there are a couple of more very specific questions where people have talked about their ailment and what they're doing. If you wish, you could take them up later. So I think we'll conclude this session. Like what we understand is there are two dimensions to every disease. One is prevention and the other is management. So likewise, I think today's seminar on well-being for people living with diabetes, it also emphasizes on the same point that there is no alternative to healthier lifestyle and people must make their health a priority. And the World Diabetes Day, occasions like these, they give us the opportunity to rethink about curbing the rise of diseases. So I'm sure all of us who joined this webinar have gained valuable inputs from you, Dr. Vishwanathan, and they will return with the motivation to renew their health journey. The webinar was presented by MV Foundation, Chennai and Bengaluru in collaboration with the Hindu under its wellness series. Thank you all.
Thank you, Ms. Basu and the Hindu for making it possible a third time.
Hat trick. I hope the message goes to the people as desired.
We want people with diabetes to be healthy. Whoever you see, doesn't matter, but you should be healthy. You should involve in exercise and diet control. We're not asking anything else. We're only asking you to eat healthy and be healthy. That's all. You see anybody you want.
Thank you very much, sir. Thank you.